Hi, I'm from Catholic University School of Nursing, San Vincent of Paul. My name is Michelle Estefania Velez Ronquillo, and I'm going to talk about gross hematuria. Definition: blood in the urine that can be seen with the naked eye. Hematuria may or may not be accompanied by pain, but it is always abnormal and should be further investigated.
Gross hematuria, blood in the urine that can be seen with the naked eye. Hematuria may or may not be accompanied by pain, but it is always abnormal and should be further investigated. Gross hematuria, blood in the urine that can be seen with the naked eye. Hematuria may or may not be accompanied by pain, but it is always abnormal and should be further investigated. Gross hematuria, blood in the urine that can be seen with the naked eye. Hematuria may or may not be accompanied by pain, but it is always abnormal and should be further investigated.
Applications in medicine. Patients whose urine tracts have non-detectable abnormalities normally release small amounts of blood into the urine, so that several red cells per high-power field may be seen upon microscopic examination of the spume sediment. This fact, together with the low prevalence of clinically detectable disease in some group of patients with asymptomatic microscopic hematuria, has led some investigators to suggest that minimal microhematuria in an asymptomatic young adult needs no evaluation. Pros and cons. More serious causes of hematuria include cancer of the kidney or bladder, inflammation of the kidney, urethra, bladder, or prostate, and walnut-shaped gland in the man that surrounds the urethra at the neck of the bladder and supplies fluid that goes into semen. Polycystic kidney disease, blood clots, blood clotting disorders such as hemophilia, and urinary tract infections can be largely prevented with good hydration and frequent urination and complete emptying of the bladder.
Causes of hematuria. It is easy to remember the causes of hematuria if you think with the urinary tract causes and then the non-urinary tract causes, or the other causes if you take the anatomical consideration first. Like first, the diseases affecting the kidney, disease of the ureter, diseases of the bladder, diseases of the prostate, and pain. The other causes, transient causes, some familial diseases leading to the hematuria, some drugs the patient is on leads to hematuria, diseases of adjacent organs. Adjacent organs like uterus and cervical disease, like colorectal disease. So we'll take one by one. First, we'll take the causes of hematuria by the diseases of the kidney, then ureter, bladder, prostate, and then we'll go on to the transient, familial, and medication and adjacent organs. So we'll take one by one.
Issues applying in Ecuador. Microscopic hematuria is a commonly seen condition in the emergency department which has a variety of causes. However, most importantly, microscopic hematuria has a high diagnosis yield for urological malignancy. 30% of patients presenting with painless hematuria are found to have a malignancy. The majority of these patients can be managed in the outpatient setting.
Otherwise known as hematuria, is never a normal condition. Hematuria has multiple causes. The most common being urinary tract infection, kidney or bladder stones, trauma, even running can sometimes cause hematuria. Kidney disease, and the most serious cause of hematuria is cancer of the kidney or cancer of the bladder. When you see your doctor, he undoubtedly will do a urinalysis, checking for the cells in the urine, and sometimes looking for malignant cells. CAT scan is usually recommended to visualize the kidneys and bladder, and usually a trip to the urologist or kidney specialist who will look in your bladder with a scope called the cystoscope, looking for stones or tumors. Treatment of hematuria depends on its cause. As I said before, hematuria is never normal, so if you have this condition, see your doctor. For TV6's Medical Minute, this is Dr.
In conclusion, gross hematuria caused by thyrocarcinoma metastasis to the bladder is extremely rare, but can be present as an initial symptom of distant metastasis or as one of the symptoms of advanced disease. Thyroid carcinoma metastasis to the bladder should be included among the differential diagnosis of gross hematuria, especially in female patients with a clinical history of thyroid carcinoma.
Your body's red light warning signals, symptoms that are listed from head to toe for kids, adults, pregnant women, over 300 doctors give input into this book. They volunteered just so you know when to potentially go to the doctor and when it could be an urgent problem. How about if you have a little blood in your urine? But you feel fine. You just notice there's a little blood in your urine when you look at the toilet. Is that a serious problem? It could be. It could be an early sign of cancer of the bladder or cancer in another area relating to the kidneys and bladder. So, early evaluation can pick that cancer up early when the doctors can take out the might not be anything serious, but it's definitely worth an evaluation.